What we're going to do today, we're going to look at contemporary approaches to dementia care. We're going to build on what we did yesterday and look into the way that dementia has been understood through the ages. And to do that, we're going to look at the perspectives on dementia through the centuries. And that will help us to understand how it's been seen by others over the years. And then we'll move into some of the contemporary approaches. How is it currently seen through the lens of validation therapy, reminiscence therapy, Montessori approaches, multisensory stimulation, the eat-in alternative and animal-assisted therapy. These are various contemporary approaches that often we hear about but we don't look into much. So this is a way for us to spend some time today looking into various approaches and to seeing how they might lead you to approach a person with dementia slightly differently. Maybe if you're using a validation approach, you would use a particular way of relating with the person or even seeing what the problems are. Or the Montessori approach might lead you down a different path of understanding the problems and understanding the person and then understanding what you might do about that. And again, the eat-in alternative might take you down a different path. And we've got two experts in the eat-in alternative in the group today who can help us understand that. So there are some documents on the eat-in alternative up there on the LMS, and if you know of others, Bernadette or Linda, please let me know. We'll include them as well. So that's our goal. We'll also include a little bit of information about the person-centred approach, because it's a philosophy that underpins many of these approaches. So we need to understand that philosophy as well if we're going to understand modern dementia care. Okay, so the first, you'll find you've got your slides open there? Okay. In our perspectives on dementia, historically what we'll look at is how dementia has been seen in the arts and in literature over the history of the last few centuries. And we'll look at the biomedical approach. How has the biomedical approach been seen? How do we understand that today? The person-centred approach and then the relationship-centred approach through history as well.